parents. My name is Irina and this is my channel. Today we're going to talk about the very important tips, very important information about breastfeeding and breast milk. So if you're a nursing mom or you're going to be a nursing mom, you must know this information. Please watch this video till the end and please subscribe and click like and leave your comments. I will appreciate it, and we get started. Number one that I want to talk about today, it is to compare breast milk and formula. What is the better for your baby, breast milk or formula? The answer can be only one. It is definitely your breast milk. It doesn't matter how expensive and how well adapted formula you buy, your breast milk is the best for your baby. It has the right amount of water, calories, nutrition, fat, what your baby needs at that moment, and it receives the signal. When a baby is sick, for example, the signal goes from their spit to your nipple, and your body receives the signal and understands that your baby is sick, and it produces the right milk that your baby needs at that moment. Isn't that amazing? So it is definitely when we talk about breast milk or formula, definitely breast milk. But sometimes when woman cannot nurse her baby, or it has a lack of milk, of breast milk, and it happens especially with the firstborn baby, and she buys formula, and that's okay, because the breastfeeding it's really hard work and it can be really stressful, apart from the stress that she already might have. So she buys formula, and that's okay. And the most important thing, that she doesn't listen advices from the older people, you know. Then the grandmas come up, it's like, why you feed them with a formula? It's just a powder, milk powder. Let's try cow milk, and it has more calories, more fat, and it's vitamin D, it's more healthy. And here is a dangerous thing, because cow milk, and especially goat milk, that has a great amount of phosphorus that the baby's kidneys cannot process. It is prohibited at all to give cow milk to your baby under 1 year old. After 1 year old to 3 years old, you can give them a cow milk in very limited amount. It is a 7.5 ounces per day, or it's 200 milligrams. Basically, it's one glass of milk. But after 3 years old, your toddler can drink cow milk in an unlimited amount, how much she wants. But under 1 year old, not at all. Yeah, when we have a question, breast milk or formula, it's definitely breast milk. When we have a question, formula or cow milk, it's definitely formula, because the formula is adapted to baby's stomach. So how you can understand that your baby is full? When a baby stop latching and release your nipple, it doesn't necessarily mean that they are full. With the breastfed babies, when they are close to you and they listen to your heartbeat, they fall asleep pretty easily before they get satisfied. That's why it is really important to encourage them continue latching. It is waking them up all the time, and apply cold thing, apply like ice to their feet. It helps them to wake up as well. So it's you need to give them a good amount of time on each side of breast, on each side. It's very different with each baby. It depends on their speed of their latching, but its average amount, it's 20 minutes on each side. With my baby, it took around like 30-35 minutes on each side. It was was waking them up all the time. So make sure that they get to a back milk. And here's a tip number 3: back milk. If you're a nursing mom, you should know the terms exist, like a front milk and back milk. And even people also recognized as a middle milk. I will make the separate video. I don't want to focus too much on the front and back milk right now, but it's the front milk what the baby eats from the beginning, and back milk which has a more fat and more calories, what they eat after a certain amount of time. So that's why, as I said before, it's really important to encourage them, to wake them up and make sure that they get to this back milk. I will make a next video about the front and back milk. Yeah, that I will tell more in details what it is, and focus my attention only on the front and back milk. And do not miss it, and I will put the link in the description box below. Do you need to give water to your baby? So what American Association of Pediatricians think about that? Before 6 months, your breast milk is enough. Your breast milk already has a right amount of water. Even in the hot weather, your breast milk becomes more watery. In the cold weather, it becomes more fat. So you don't need to give them anything extra of that. And before 28 days, it's strongly not recommended to give water to a baby at all. After that, if you give them, they don't die, but it's not really necessary. And after you start giving them a solid food, the water is necessary. But what to do if you see your baby is thirsty and it's really hot air in the room? Your task is to keep the air coolish and humid, and high humidity. Hey guys, I think we have a company since then, and he is strongly trying to be on my way and trying to help me to tell more about breast milk, because he knows the best. And can the nursing mother have a coffee and tea? Yes, yes, she can. But it's only one issue here. If you notice that your baby doesn't sleep enough and doesn't stays up all night to get fun, you need to reduce amount of caffeine that you drink during the day. For me, it was a tip. It was okay. I drink 1 cup of coffee each morning, and this is fine because I don't see any effect on my son. But it's only one thing: if I drink a coffee in the afternoon, well, he cannot sleep at night right away. So pay attention at that. Can nursing mother have alcohol? The answer is no. Absolutely, even a little bit. The modern medicine doesn't know what effect it can have on the baby, on the development of their brain, respiratory, digestive, and nervous system. So the answer is not at all. Food can be very allergenic, and you see that your baby has allergy. You see usually a red rash on their skin, and it can be itchy and can cause discomfort. What you need to do in this case, you need to cut off the allergenic food. What is allergenic food, and what food considered be really allergenic for baby and nursing mom? I will make a separate video because it's a whole blog. I will not cover this subject in this video. But if you see, for example, that your baby has a allergy on the fish that you eat, you need to cut the fish. But here's the one issue: if you cut the fish and you see that the allergy doesn't disappear, it means it's not fish. You need to find out what it is. The next tip: what a nourishment of a nursing mother should be. The answer is only one: diverse and delicious. No hungry strikes, no diets full of protein. If you're a vegetarian, you need to talk to your lactation consultant and to a doctor, that they can help you to build the right menu, that you have enough fat and calories per day. But if you have your baby has colic, you probably need some limitation in the food. I made a video for that, how to prevent colic, and I put the link in the description box below. Check it out. And whatever food you eat during the pregnancy, you should continue eating after you became a mom, when you're nursing a baby. Maybe some exotic food and the food that is not familiar to you. If you haven't eaten that before, probably you shouldn't start at this period of time. Fish, seafood is awesome for a nursing mom. Fish is rich of omega-3. Some fish, like a tuna and shark, that has a great amount of mercury, and it's better to avoid that while you're nursing. And remember, the amount of liquid that you drink during the day, it affects your breast milk supply. The more you drink, the more breast milk you get. So how to increase your breast milk, it's check out my video about that, and I tell you in the details. And thank you for being with me. I love you all, and don't forget to subscribe. God bless you.